video that follows is a very brief sort of just an impression of how it might be for a patient when they get given eye drops and get to take them home, possibly for the first time. Mrs. Smith is going to kind of talk through her thoughts, opening up the packaging, etc., and the type of difficulties that maybe as a pharmacist we need to be thinking about when we do dispense these items for patients. So I'd like you just to watch this and just to kind of just to understand what it's like for a patient actually having these medications. Go.
Oh, right. See what is given me. 10 Hypromelos 0.3 eye drops, 0.4 mils. Right. Wow. Instructions. It's very small. 1 drop into each eye 3 times a day, not to be taken by mouth. And that's my name. Right. Okay. So now I've got to get into it. Oh God, it's tight. Oh. Things for old people are usually made by the same people who make stuff that children can't open. Right, so 1 drop. Okay. So this is going to go everywhere. Don't know how they think I'm going to manage. Don't they know I live alone? There's nobody to help me. Right, glasses off. It makes it go better. Bit of tissue. 1 drop. Now, tip my head back. Tip my head back. Is that near the eye? Yes, it's near the eye. Now, how do I know how much squeezing for 1 drop? Oh, that much squeezing. Right. 1 drop. Look up. Oh, I missed the eye completely there. No, I didn't. A bit of it's gone in. Try the other one. It's very painful tipping my neck back. Try again. Get it near the eye. I think that's gone in. But I don't think it's gone in as well as it should. But that's because I find this difficult. I think I would rather have somebody put it in for me. And that is difficult because I live alone. Oh, lot of hassle for an old person. I'll probably only do it for a couple of days and then I shall forget.
Okay, Mrs. Smith, how are you getting on with those eye drops?
Well, they were in a little box with little typing on them, which was hard to see. The box, funnily enough, was quite difficult to get open.
Right.
Then, of course, I needed to work out how much, well, to get the top off was hard, really hard. Then to get how much squeezing to produce 1 drop, I had to get something to cover myself with. And I did squidge it in, but the thing is, when you're elderly, you're particularly prone, I think, to your spine curling forward, so tipping your neck back is really painful.
Right.
And I can't get my head back as I would like it to be.
Okay.
I mean, ideally, I would like somebody to put these in my eyes when I'm lying down.
Yeah.
But I live alone, so that's not going to happen.
Okay.
So, I mean, I'll give it a go, but whether I will stick with it...
Okay. But some of the things are difficult to open.
Yeah, that bit was actually really hard.
Right, yeah. And then actually putting in just mobility, just
Yes,
being able to move appropriately.
Yeah. And working out how much to squeeze, because if you don't work that out at the beginning, you're either going to get none or too much.
Yeah. Okay. And what about the instructions? Could you read the instructions on that?
Well, glasses. On the box, I could just about read the small print, and this I can just about read the small print. keep out of sight and reach of children. Once open, discard any unused solution for use 90 days, presumably unused solution. Yeah, and then it just tells you what's in there.
And generally your eyesight's fairly good with the glasses. So
Well, it's reasonable, yes.
yeah,
I mean,
yeah. But just an issue. Imagine
Yeah.
if your eyesight wasn't as good, might be more tricky, mightn't it?
Yes, I had to feel to my eye
Right.
rather than just look up and drop it in. I had to make sure that was near my eye, and even then it wasn't as near the eye as it would have been if somebody had done it for me.
Yeah. Okay. Oh, that's really useful information. Thank you so much for that. Okay, thank you.
My pleasure.
So there's some food for thought there for us to try and remember when we're actually dispensing eye drops for patients. And I hope Mrs. Smith's words will stick with you when you do become pharmacists and you are handing out medications to patients, to actually think about what it's like when they get home. Many people live on their own, and that can be a significant factor as well. So just take some notes about what your impressions were of how she got on with that medication.